Hello and welcome to YHTV's Magical Medical Tour. This is episode 35. I'm Christina Suzuma, and here with me is our wonderful medical guide, Dr. Glenn Woolman. Hello, Doc.
Hello, Goo.
What's up, Doc?
How are you today?
Good. Were you howling with the full moon the other day?
I always howl with full moons. I am a moon child.
Did you howl this morning? That moon was brilliant in the sky this morning.
There's been a lot of great sky for the last week or so.
Thank goodness. Thank goodness we're not going through what the East Coast is going through.
Yeah, we should send good energy out there.
Yeah.
And hope. I know there's people that need some healings right now.
Mm-hmm. Mm-hmm.
So from Magical Medical Tour and Trinity of Life, we should send some healings in that direction. We're thinking about them.
Yes, absolutely.
You know, in thinking about Magical Medical Tour, we're going to go off into another tour this week, another quadrant of the galaxy. We've been focusing mainly on healers, but I thought as part of what we really want to do on this show is show all aspects of the Magical Medical Tour. And one important part has to do with those that are needing to be healed and those that have been healed. And so today, we're going to be interviewing a very special person. He's a retired professor of theater. His research was in theater anthropology. He's a professional director, designer, and actor. And he's currently the executive artistic director and founder of a regional theater outside of Aspen, Colorado. And he's also my friend of 53 years. This is Lon Winston. Say hello to Christina, Lon.
Hello, Christina.
Hello, Lon. Thank you so much for honoring us here on the Magical Medical Tour.
Well, thank you for having me.
Lon, usually we, as the medical guide, I like to tell our viewing audience, our global participants, the path that we're going to take. And this is going to be a completely different path than we've done with many of our past episodes working with healers. We're going to look at things from a different point of view, and knowing that you are an artist and a creator and an actor and a director and a study of anthropology, all of these things I think will come into play today as we go through your journeys of being diagnosed with various types of cancer. How's that sound for you?
I'm leaving. That sounds fun.
He did say diced.
yeah, diced. That's right.
How many parts?
Many, as we will probably learn.
Oh.
It's yes, and I guess we're setting the tone already that the title of this is Cancer. Is it a word or a sentence? And I like to think that we're going to look at that from many aspects today, including humorous ones. So I want to start out pretty quickly because we have a lot to cover, and I know that you will have great things to say in many different areas. But right at the beginning, you were diagnosed with, not at the beginning of time, but just in the beginning of your cancer journey, you were diagnosed with a few simple skin cancers that were relatively easily treatable, one more difficult than the other. But what was your first experience with hearing the words, "you have cancer"?
Well, first I was wondering how come you weren't getting them, and I was, since we grew up in the same sunshine. But, actually the skin cancers, when they were first mentioned to me, didn't really hit me hard, which is interesting because growing up in Miami and then living out here near Aspen, it's the two worst places. And so I kind of expected it at some point. I mean, friends and relatives all over Miami were getting things frozen off and biopsied, and I just kind of figured that one day that was going to come my way.
And it did, and you went through it. And just to move quickly through this, is there anything you would say to people now Would you say don't enjoy the sun like I did? Don't use the baby oil and iodine and every other
Oh, no.
mythological way to get a little more tan? Would you
Well,
change that?
and yes, yes. I mean, we both worked on the beach. We were in the sun all the time, and really the damage happens when you're really young. And I
Mm,
peeled, burned, and peeled from the time I was 4 years old, all through my teenage years, blistering and peeling. I mean, and how dark can you get? No, I would take a different path today. We've
mm.
learned a lot. My parents smoked cigarettes. I didn't. It's because we learned a lot. Um, so yeah, I would definitely take a different path. I don't go outside to work even up here without long sleeves on and, major creams on my face and arms and legs.
Yep.
Mm.
So, moving on, knowing that you are someone who loves sports and especially endurance sports, and you have great cardiovascular, you do alpine skiing, cross country skiing, snow shoeing, kayaking, canoeing, mountain hiking. Uh, all of the things that you do are endurance. And I'm bringing this up because I know you were on a mountain one day with some friends that seemed to change your life. You want to tell us about it?
We were hiking from Aspen over to Crested Butte. You have to go up over West Maroon Bell Pass. It's about 12,000 feet, little
Wow.
above. And we've done that hike often. And we were talking and walking, and all of a sudden, things started to change. My friends were way out in front of me. My wife passed me with her girlfriend, and pretty soon I realized that they were totally out of sight. And I was like going, okay, I can get to that rock. I can get to the curve in the trail. And by the time I got to the top of the pass, they were all sitting around eating lunch. And I went up to Deborah, my wife, and I said, I'm in trouble. And I didn't know what it was, but I ached all over. I could hardly breathe. And as we started to head down to Crested Butte, I started feeling a little better because we were descending and I was getting more oxygen and it was feeding my body. And we were fine in Crested Butte that night, but I was still fatigued and tired. And then we came back home. And it was over the next couple of days that it really started to hit me.
And what hit you?
Well, we were cleaning up on our land. We have 10 acres, and there's always a lot to do in the fall. And this was September. It was after Labor Day.
About how long ago?
And I was standing in the middle of the driveway, just staring at the ground. And Deborah said, "Is something wrong?" And I said, I don't know what I'm doing. I can't even take a step. I'm just sort of in a fog. And
Mm.
so I went in and, she felt my head, temperature, maybe we got something. And I called the doctor and he said, "Have you taken your temperature?" And I said, "No, I felt it. I don't feel warm." He said, "Well, take your temperature and call me back." And so I took my temperature and it was 102 and I didn't feel it.
Mm.
And that was very strange for me. And so I went in to see him the next day and he did blood tests. And then he called me on the phone and he said, "This is a little over my head, Lon. You have no white blood cells, zero. And my H&H, my hematocrit was like 20, 21. Hemoglobin, did I reverse these?
Yeah, you did, but
Hemoglobin,
that's all right. Yeah, you
yeah,
got it.
the was 6.2.
Normally would be 12 to 14, maybe 15, and the hematocrit might be up in the 40s for
Yes.
those that are listening.
So I was less than half of both, really. And he said, we booked you into the hospital. And I went down and checked in. That was actually 3 years before 9/11. It was 9/11, 1998.
It was your own 9/11.
My own 9/11. That's right.
So they put you in the hospital, but they didn't know what was wrong right away. How did they figure out what was wrong with you? You know, usually when someone can't breathe or something, they think of the heart and the lungs, and you were an endurance guy.
They put it, yes, exactly. And my doctors, I mean, they know me. I mean, we all are into sports and activities, and I was put into reverse isolation, and they did more blood tests, and the the pathologist at the hospital could not find it. And so they sent my samples to the Mayo Clinic, and it came back from them. They had the correct stains, and they were able to find what I was finally diagnosed with.
And this is part of the magic of the medical tour for me, that somebody comes into a hospital and people start working on them to try and find something. And they even work with people in hospitals from other parts of the country. You know, so doctors and scientists and lab techs were taking a look at your blood and preparing it in a way that someone could help you in a diagnostic process, which would then hopefully mean some kind of a treatment. So they come in, and who was the one that talked to you, and how did they tell you what was going on finally, where you had this diagnosis? How long was it also while you were in the hospital? 2 weeks in reverse isolation.
Yes.
And that means to people, let me just explain that. That means to people that were worried about Lon's infectious process, his immune system. So Lon was okay to be where he was in the room, but anybody that would come in the room had to be masked and gowned and very carefully selected to see if they could go in the room, because without knowing what was going on, we didn't want to bring in any other disease states. So continue, Lon.
So I was taking a little nap, and I opened my eyes, and Dr. Kathy Hassel, who is the oncology hematologist out of Denver, comes up to the valley and does a tumor board at the hospital. And she had long blonde hair. She was in blue jeans with a carabiner hanging on her belt with keys. And I looked at her and I went, excuse me. And she said, I have good news and I have bad news. And just the fact that she said, I have good news, instead of sitting down and saying, I only have bad news, was a little lift up for me. And
you needed it.
Yeah. And she said, you have a very rare leukemia called hairy cell leukemia. And we have the magic bullet for it. And so that was, good and bad news. And the treatment for it was a complete immersion, 24/7 for 1 week of a chemotherapy called 2-CDA. And it was injected into me, and literally for 1 week, 24 hours a day, bag after bag after bag, was flushed through my system. While I was in the room, they told me, you're going to get tired, you're going to this, you're going to that. And I said, you need to help me with this, because I can't just lay here and let this happen to me. I have to have some control over what's going on. They brought me in a stationary bike. I rode 15 miles a day while I was IV'd to the 2-CDA.
Mhm.
I figured out a whole series of asanas for my yoga to do on the bed, holding onto the bed, in bed, on the chair, because obviously I couldn't lie on the floor. And that was a good thing. And I did that for the 7 days, and they sent me home with a very low blood count after having, it was even worse than, if it could have been, worse than what it was when I went in. But then they sent me home, and things started happening that were not good after I got home. Do you want me to go?
No, before you do that, when you were diagnosed with a cancer, what went through your mind at that moment, other than good news and bad news? You heard again.
I was scared to death.
Yeah, you heard it was cancer, and this time
this wasn't a basal cell carcinoma, on my hairline. This was serious, and of course I got my laptop, brought it in, and knowledge is power, and I feel really comfortable researching and knowing, and had an incredible support team, you and my brother, who researched every drug that I have taken over the last 15 years on the pros, the cons, from a biochemical, a toxicological point of view, you from, treatments and choices. So I had a pretty extensive support team behind me in terms of gaining knowledge. In fact, my doctor in Glenwood said there's probably nobody in the state of Colorado who knows as much about hairy cell leukemia as I do. I told him to invite me to the tumor board.
Little did you know the foreshadowing there.
That's right.
You alluded to the fact that you got home not feeling well, but they felt they had done what they needed to do at this point and sent you home to have your recovery and healing. How'd that go for you?
It didn't go well. I came home, I had my mask, went for walks around the land, and woke up 2 days later hallucinating with 106.2 temperature. And Deborah has very funny stories around that. It wasn't very funny to me, but she said, "I'm taking you to the hospital." And I said, "No, I'm not going there." She said, "Well, I'm going." So, yeah, you're going to be home alone, or you're going with me. And I had contracted cryptococcal meningitis, which is a fungal meningitis, which is not unlike what's hitting our country right now that we've all been reading about from the tainted steroids from, that's been going around in like 13 states now. And it's very, very difficult to treat. And they brought my temperature down with ice blankets at the hospital. Now I was past scared because I really didn't know where I was and what I was doing. There was a period of a couple of days where I didn't know anything. It was almost like being in a coma. And they ended up, my doctor came in, and again, I heard now from another tier of doctors that it was over their head. So I had heard it from the initial diagnosis, to that I didn't have blood, and then to this moment. And I was air vac'd down to Denver on a small emergency plane and brought to the CU, the Colorado University Hospital in Denver, where I was treated for cryptococcal meningitis. And this is where Gary, my brother, stepped in again with phone calls to the doctors there, because the drug is amphotericin, Ampho the Terrible, they call it. But there was also a flucytosine, which was another drug, and they were experimenting in other parts of the country with a cocktail between the two drugs. And my brother spoke to the doctors and said, the results have been very, very positive. I want you to treat my brother with the cocktail. And they did. And 8 days later, I left the hospital and went back up and continued treatment for another month as an outpatient at the hospital, and recovered from the cryptococcal meningitis more quickly than most people, and most people do not recover from cryptococcal meningitis. They were pretty amazed that I had recovered from it. In fact, I went in for a physical with a new doctor a couple of months ago, and he said to me, "You're the first person I've ever met who's gone through this and that I'm talking to. Basically, you're alive."
So the antifungal medications worked, and thanks to your brother and the other people that were taking care of you, many different people taking care of you. How was the cancer at this point? Let's
fine.
not forget. Cancer was fine. It was good. Loved it.
I mean, I always like to do things the best possible way. So now we were like moving into, by the time I was finished being treated up here as an outpatient, 2.5 months had gone by, and we were moving into Thanksgiving and Christmas time. And my white blood count and my red blood count were starting to come back. And my absolute neutrophil count was starting to reach a point where I was being a little bit protected. And that's a good sign, because that means those little baby white blood cells are happening. You know, they're not there yet, but they're happening in the marrow. And so my blood seemed to be recovering. And that was a great thing for my head, to be able to, okay, I can do this. And then, in my research, Glenn, as I was looking through it, I started to understand that hairy cell leukemia may not, in fact, really be a leukemia. It's certainly a blood disorder, a mutated white blood disorder, but they're thinking of it more as a lymphoma of the blood as opposed to in the categories of leukemia. But they call it leukemia, as you know, if it's in the blood and it's a tumor, it's a leukemia.
Right.
So
you're at some point you were in a remission. Didn't you go to a remission point where
my blood came back, and I proceeded to live a pretty normal life for the next 8 years. My blood levels were all normal, low, and that's another aspect of this which you're aware of how many years I was told that I was just anemic by my doctors, and my doctors today say that I was not anemic because of iron deficiency. Eat more raisins. It was clearly they don't know where it comes from. They don't know how it starts. They don't know what causes it. I probably had hairy cell leukemia for many, many, many years, long before anybody even knew that I had it, and actually longer before they categorized it as a hairy cell leukemia. I mean, so many leukemias have been kind of discovered, and all require different treatments as opposed to just that general treatment for all leukemia.
Yeah, there's a lot of discovery always going on, as we'll speak about in a little while, in the research area of cancers and leukemias and treatments and ways of looking at them. So your you're feeling better. Life is getting back to a little bit of normal, and
Right.
you're doing things, and you're starting to feel a little comfortable in the fact that life's okay again. Did it? I made it. Then what happened?
Well, it came out of remission. Um,
Mm.
my accounts started to drop, and so they treated me with the 2-CDA again. There are other treatments, interferon and some other drugs that they're using, but the most common one for hairy cell leukemia is 2-CDA. And since I had taken to it so well the first time, they treated me with it a second time. But the protocol over the 8 years that I was in remission had changed. So I was treated 1 day a week for 2 hours for 6 weeks instead of 24 hours a day for 7 days. So it doesn't go in and annihilate your immune system the way it did the first time. And that was pretty magical.
Yeah.
And went through that, and the and that didn't last very long. That lasted a couple of years, and then it came out of remission again.
So we
And
had to, at that point, start to look for other ways to go about this treatment, just with the medications that were out there. So this is where I think your brother Gary comes in again.
comes in again. Gary started doing some research. Um, he's able to go to websites that I can't go to. And he found out that there was a clinical trial at the National Institutes of Health in Bethesda, Maryland, under Dr. Robert Kreitman. And they were doing some cutting edge drug therapy on hairy cell leukemia.
Mm.
And I went out there for a battery of tests. They have certain protocol because the pharmaceutical company that's supporting their research, it's not just everything is government at NIH. I mean, they are obviously getting grants outside the government as well. And the pharmaceutical company had their own criteria. And so I went out for the series of tests because I couldn't use the drug that they were experimenting with if I didn't have a specific protein on my white blood cells that allowed the drug to attach to the white blood cells. Smart bombs, everybody's aware of chemotherapy moving into the smart bomb area. Um, Unlike our government, who hasn't figured out smart bombs yet. But the I happen to have that protein, and I was very lucky. I mean, there's a lot of people that have hairy cell leukemia that don't have that protein. They have other proteins, and I have the protein that it attached to. So it attaches to it and it implodes it. It keeps it from dividing, and I was able to. I got accepted into the clinical trial and proceeded to begin that whole process. And and then I got very similar to the cryptococcal meningitis. Something else sort of sneaked in and took the day. Do you want me to go there?
No, not yet.
Okay,
I
that's
think we're
why I'm
having
doing it in segments.
right. We're having way too much fun with your leukemia. I don't want to leave that right
No,
away.
no.
Let's talk about making a decision to be in a clinical trial. This is very important. It's almost in my mind, it's a living version of organ donation, where people that do this are willing to try something. Of course, it's a point where they already know that there are relatively safe features about it. And now they're looking to really refine things. But there is sort of a mystery part of this, that they don't know all of the things. That's why it's still research. So when a person has to make that decision to go into a clinical trial, that's usually, many people have to make clinical decisions about cancer, and they have to look at all options. And one of them certainly is a clinical trial, but not everyone is necessarily appropriate for that. How did you determine that you were willing to be in a clinical trial?
Well, that's a really good question, because you go through a lot of thinking. All of a sudden, you're not a patient; you're a white rat. And having watching my brother deal with white rats for umpteen years, I know what happens to white rats.
Right.
Um, and then I got, the 75-page document, which I sent to you, on side effects. This is not the side of an aspirin bottle. It's literally 75 pages of every conceivable thing to you having to sign away your life. I mean, basically, that's what you're doing. That's the scary side of it from one point of view.
Especially,
The other,
let me just add, especially if you're a person that has a monkey mind.
And I am the king of monkey minds. There's there's no question about that. A lot of people have a song in their head. I don't. I have conversations in my head. And if I could put it to music, we would have found our safety pin a long time ago. But I think that the other side of the coin for me is that I love research. It doesn't matter what discipline you're in. I mean, in my field, I do as much research as an artist, as a theater person, who also investigates the anthropological implications of theater throughout history. I love research. I love discovery. And so that part of me wanted to be part of this, wanted to be able to contribute to somebody else's research, especially since I was going to be the recipient of hopefully good news. So, and there were alternatives, but the alternatives weren't necessarily high notes to what I might be going through. I was ready to do this. So, I went from the freaking out moment to, the white rat syndrome to I can contribute something to medicine and to the world this way. And that made me feel good. It actually brought me to it with a little positive atmosphere and milieu. And around that, I think, is part of where and how I heal. And so it was all good.
So you enter into a protocol, and to get into this thing, just as a quick aside, let people know some of the kind of things. Most people go in for their physical exam, and they have to get some blood tests, so they get 2 or 3 tubes of blood and a urinalysis and things like that. Right. You had a little more than that, didn't you?
Yeah. Yeah, each time, biannually, 26 tubes of blood taken for every kind of test there is, but also I'm donating blood to the research. So there's things that are definitely identified just for me, the drugs I'm taking and what's going on with me personally, but it's also blood that's helping Dr. Kreitman do further research to take the clinical trial, which is now, I think, in phase 4. So the drug has changed dramatically over the last 3 to 4 years.
when you went on to the protocol and it required, what was it, 5 different doses?
Well, actually, some people have gone through 10. It's you go out there and you're treated, and then you have a day off, and then you're treated, and you have a day off, and then you're treated, and you go home, and you come back a week later. And I did that twice. They like you to go through it 5 times. There have been, from my understanding, there are patients that they have that have gone through it 10 times.
So you're there for your second time, feeling pretty good. They seem to be getting some good results. But before you went there, it was flu season.
It was flu season, and I got a flu shot. And my lymph node in my neck swelled up on me. And I called my doctor here, and I said, I've got this little lump in my neck on my left side. He said, what side did you get the flu shot on? I said, my left arm. He said, people get reactions to flu shots and it affects the lymph node in your neck. I wouldn't worry about it. You tell me not to worry about something is saying, worry, worry. And the monkey mind starts to go. And I ended up having that lump for almost 3 months before I went out in February for my initial tests. And when I got there, I told them everything that was going on with me. I mean, they wanted to know everything. And they felt it. And, I told them what my doctor said. And they said, we should biopsy it, because now we come back to the pharmaceutical company. You can't be involved in the clinical trial if there's any other kind of cancer that you have in your body. They were even concerned about, the basal cell. I had a little squamous removed on the side of my nose. And, today we think that all of these things are under the umbrella of my weakened immune system because of the hairy cell leukemia. It allowed them to set in. We'll get to the other with you in a minute, I'm sure. So they aspirated it, and they did it 4 times into the lump. And I had already gone through 1 treatment, and it the first 3 aspirates were perfectly clear. And so they went ahead with the second treatment.
For the leukemia,
yes,
right?
Yeah, the clinical trial. The
for hairy cell leukemia.
For the HCL. And then they, the pathologist just, maybe had a few extra minutes there in the lab and decided to check the 4th aspirate, and did, and called Dr. Kreitman and said, there's suspicious cells in the 4th aspirate. And then they decided that they needed to go in and biopsy the lymph node. And in doing that, I had to, go through surgery. They opened up my neck and took out a bunch of lymph nodes. But I was told, not to worry, 97% chance that it's just a cyst. That, that given the fact that the first 3, were clear and blah, 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 blah. And they removed the nodes, and they weren't clear. Do you want to ask a question?
You want to call the audience or ask a friend?
Oh.
Yeah. So you went into surgery, you came out of anesthesia, and you were told by whom, and what were you told?
The surgeon. the surgeon that they had sent the lymph nodes to the pathology department, and it came back that I had squamous cell carcinoma tumor on the back of my tongue, way, way, way down. Actually, they couldn't find it. They went in and looked around after they got the report back from the pathology while I was still um, under anesthesia, and they yanked my tongue out of my mouth as far as they could to get to the very back spot that's even behind the glottal. I mean, all the way down. And there was a tiny little tumor on the back of my tongue, about maybe half the size of your baby fingernail. Um, but it had gone to the lymph system, and that was the same cells that they got. And so they told me that, and I was still in a kind of groggy stupor, and they brought me back to my room. I didn't know any of the implications of any of this. I was just told that I had this little tumor on the back of my tongue, squamous. In my head, a squamous cell, I mean, that, a little squamous cell, you go in, they burn it off my tongue, and I'm going to be fine. Not the same thing.
Not the same thing.
Dermatologists don't take care of tumors on the tongue.
Right. And at this point, so you got two pieces of information that were important, I think. One, you're now out of the clinical trial for your leukemia.
Correct, because you can't treat me for the squamous, which in many ways was far more dangerous and life-threatening than the hairy cell leukemia.
Wow.
So what was the plan now? And you talked to the doctor there.
Yes, the doctor came to my room at the NIH hospital, magnificent hospital, and she said to me, I asked her what the prognosis was, and she said, all comers, stage 4. I said, stage 4? You told me it was a tiny little. She said, size has nothing to do with it. It's metastasized to your lymph system. When it does that, we call it stage 4. And all comers, you have 2 to 5 years. And I mean, wham! It's like Muhammad Ali took me out with one punch. And I said, I don't think so. I'll take care of it from this point on. And we left, and we went back, and I made an appointment with Dr. Patty Hardenberg, who is an amazing doctor. If you Google her sometime, she's unbelievable. They headhunted her, I think, from Duke University to the Vail Shaw Cancer Center. And I made an appointment with her and went in and told her she's chief of radiation at the center, Shaw Cancer Center. And she listened to the whole story that we've just gone through. I mean, literally, the hairy cell leukemia, the whole thing. And she said, this is highly curable. And I'm not going to tell, it's going to be like going through hell. I'm not going to tell you everything that you're going to go through because you won't come back. I said, I'll come back. Believe me. And she started treating me. And again, it was another chemotherapy, which is a smart bomb that attacks only the squamous. I was put through the PET scan to show that it hadn't gone anywhere. It was nowhere in my body except for on the tongue and that little bit of area where they had taken out the lymph nodes. And one of the things they had to do was insert a stomach tube for feeding. I fed myself through this tube for 3 months. They told me that and you know this, I was off of that faster than any patient that they had before. I was their poster boy, which is what they refer to me as at the Shaw. And I went in and had another PET scan 2.5 years out from the treatment. And Patty said to me, I don't use this word often, but we cured you.
Hmm.
And that was the squamous. So I only ended up with 2 hairy cell treatments instead of the 5, but the 2 wiped it out of me. There were no signs of it in my blood, no signs of it in my marrow, up until 4 or 5 months ago. So it went into a complete remission. In April, it showed up in my bone marrow, and I just went in for my 26 tubes, and it's nowhere in my blood. They've got patients that hairy cell has returned to the marrow, and 10 years later, it's still not in the blood. So we're just on that phase. And I think of hairy cell leukemia the way some people might think of diabetes. It's a chronic illness. There's treatments for it. If you go to the Mayo Clinic website under hairy cell, it says excellent in terms of prognosis of the disease because of treatments that are currently going to the FDA to become they're available to everybody. And HA22, which is the drug that I had at NIH, is listed as one of like the top 3 drugs. So.
Ooh, you've been through quite a journey over there.
Yeah, it's pretty interesting on where it takes. You know, it drives sometimes, and sometimes it sits in the back seat and I drive. And the support system, the people I had around. I mean, one of the nurses that took care of me here, that's been taking care of me for 15 years now. Her name is Terry Nightingale. Isn't that incredible? I love.
Fantastic.
Yeah, and she's a doll. But it's being open. It's being open to everything, not locking yourself in with blinders that I can only be treated this way, or this way. That, you know, literally you got to know when to take out the heavy artillery, and you have to know when to mix in some of the spiritual and holistic ideas and entities into your life and be really positive. And
so now that they've detected it in your bone marrow, are you going back for treatments again?
No, here's where we go back to the initial question about the skin cancer. The hairy cell leukemia is the thing that brought my immune system down so low that it opened up the door for these opportunistic diseases to come in and to grab hold. That's one of the downsides of the clinical trial, because you can't be treated until it's in your blood, not in your marrow, and your ANC, your absolute neutrophil count, is below 1, which is not good. And that opens you up to other diseases. And so somewhere along the line in the next several years, I'm going to have to make a determination of whether I want to wait for my blood to get so low in protection to get the next treatment, unless they change the protocol, which can happen also over the years. Then I may choose a different, something new on the block that can start to help me without waiting for my blood to get so low. Clearly, I don't have a great track record in when letting my blood levels go down so low that I'm unprotected.
And what about like the Eastern medicines, like acupuncture and herbs and those forms. Did you integrate
Yeah,
that into your system?
it's the I didn't do acupuncture. We talked about it. Glenn and I talked about it. I went to an acupuncturist and talked about when I had the throat to ease the pain and everything, going through radiation in my throat, 3rd-degree burns on my neck. I mean, it was horrendous. Nobody wants you don't want to go through that. But it cured me. I mean, that was the thing. There were embracing all that's available to you, exploring it. I didn't say no, I don't want to do acupuncture. I went to one, I talked to them. Can this help? Can that? And I made informed choices and left everything open to that. Certainly, the care that I had at home from my wife was phenomenal. I mean, I don't know how somebody can go through what I went through without having that level of support and friends. My partner, who came to the hospital every day and read to me from plays, and every day, just to visit, to change your head, to so it's all good. It's all good. I feel really positive. I feel like I have a condition, and it's going to be there probably all my life. I doubt that it'll kill me. Something else will. And that seems to be the general consensus among the doctors and the research scientists.
As a thespian, it's almost like you're playing all these different roles and different parts of your life, one after the other, and you're just kind of overcoming it. It's done. I'm moving on.
Yeah. And I mean, they're all there. I mean, at least from my sense of what a true acting is, they all live inside me. They're not pretend stuff. And so it's just a matter of getting to it and revealing it. So I got to some interesting people living inside.
Lon, we always ask our healers for a health tip from their point of view, but I think it would be very interesting today for our viewers from the point of view of someone who has been healed and also who is a healer. Do you have a health tip for us?
A lot of what I've just been talking about, I think, falls into that category. I think that it's really about being open to absolutely everything, not saying no. I'm not going to do that, or I heard that was it. Do your own research, and knowledge is power. And I know what I have. I know what it does in my body. I know the drugs that I've taken, and I know what those drugs have done. And the important thing is to be open and to accept all of those things. Keep a smile on your face through it all. Laughter is a great healer. I had a friend of mine who came into, you'll love this, Glenn. I think I might have told you, he came into my room when I was in reverse isolation in his gown and mask and everything with nose and glasses on and a cigar. And he said, "This isn't one of those homeopathic moments, is it?" And it, made me laugh. I love that. And so I think that just being open and gaining the knowledge and accepting it all, and being thankful to everything that comes your way that can be a healing thing is important. Important. I had a woman brought me crystals. When I was in the hospital, do you mind if I leave these with you? No, bring them. I had people of different religious persuasions asking me, "Can I pray for you?" Well, duh. I want the prayers coming in every variety they are. I don't have the answers. I want the prayers. And to listening really carefully to every doctor. This is what we can do. This is, or we can't do. and accepting it and moving on from there.
Yeah, that's very good. So I think in my mind, the question is cancer a word or a sentence? It can be either, depending on your way of looking at it and the choices that one makes. So I would like to know, as a creator and an actor, do you have a poem you would like to share with us, maybe about your illness?
Funny you should ask that. Let me pull one up here for you.
Just happen to have something.
This. Yeah, I do, and I do write poetry. And I wrote this one a few months ago. Seasoned traveler. I've been to hell and back a few times. Not the biblical place, not the medieval image place, not even the irony of a Bosch metaphor place, although I love the garden of earthly delights. My hell is under the skin, having a swimmingly good time in my blood. But I know how to get back. I memorized my way back. I also put breadcrumbs out. Take no chances. I followed them carefully because I'm a seasoned traveler.
Wonderful. Thank you for sharing that. Lovely.
Thank you. I hope that, I've watched most of the shows that you guys have done, especially my family members. And I think that I just hope that this helps, that it reaches out to people from a little different point of view than the healer, the healee. And it's good. This was good. I'm glad we did this.
Yes, me too. And I would like to personally, and on many levels, thank my dear friend, Lon Winston, for sharing his journey, his wisdom, his expertise with us in such a beautifully dramatic manner. We know that this will help people that watch this, not even just today, but into the future. And I would like to wish everyone a good week as we go into another journey traveling through the healthcare galaxy. So before we leave, I would like to say thank you, Christina, and I would like to wish you all optimal health. Thank you, Lon.
Thank you.
Thank you, Lon. Thank you so much for just sharing your experience with all of us. I know the reason why we do these shows is so that others can hear and listen and be inspired by people like you. Sometimes that endurance and that stubbornness, when you just say, no, I'm not going there. I think that's very, very inspirational, not just giving in to what someone says, but just knowing within yourself the direction you want to go. Thank you for empowering others, with your moment today. And you see, usually you would be on my show. Not on this show, right, Glenn?
No,
because of my yoga in the hospital room.
No, actually, because I usually interview people who have inspirational stories such as yours, and but that's okay. I'll share some people with Glenn. No,
and I do think it's important for people to be really healthy. You never know when something is going to happen. And one of the things all my doctors said to me is, you're getting through a lot of what you're getting through because you're so damn healthy, which is kind of ironic. You've got cancer. But
many cancers.
Many.
Yeah.
But it started on a good platform.
Exactly. And that's really important.
Absolutely.
That's why I always talk about preparatory medicine, not just preventive medicine. You have to be prepared.
Yeah.
Completely agree. Well, thank you so much, gentlemen. And thank you to all of you who continue to support us here on YHTV. We invite you to join us every Tuesday at 10:30 a.m. Pacific Standard Time, 1:30 Eastern Time for Magical Medical Tour. And of course, at 11 a.m. Pacific Standard Time at 2 p.m. Eastern Time for Trinity of Life. You can find Dr. Glenn Woolman at myyogahub.com/G Woolman and on Twitter at Glenn Woolman, one word. And of course, through his own site, glennwoolman.com, where you can learn about his metaphor square breath. I'm sure Lon used that quite often, huh, Lon? As part of the yoga. Okay, thank you. And until the next time, namaste.